So one thing that has been a huge support with AI is documentation, that we are required as therapists to document all of our sessions, to create treatment plans, and this is very time consuming.
Thank you so much for joining this episode. We are really excited about knowing more about your organization. But before we dive into your organization, I think a good starting point will be if you explain a little bit about your own journey in this space, uh, where you are right now, and how you reached this point, and were there any personal stories that crafted this career path for you?
Yeah, so my name is Laura Richer, and I'm a licensed mental health counselor. I started as an individual practitioner and worked individually for many years. And then in about 2018, I really wanted to create a group practice or agency. I got really tired of working alone. I wanted to have peers to collaborate with. I really think therapy is better when you have a team that you can work with, get a lot of different insights, and be able to support each other. So in 2019, we moved toward, or I moved towards creating a group practice. I hired my first employee, another licensed mental health counselor. Um, and then COVID hit, and I wasn't sure what was going to happen, if we were going to have to, shut down completely, if it wasn't really reasonable that I could build a business at that time. And it was, in fact, quite the opposite. Mental health space blew up. We scaled very quickly during that time. I think by 2020, we had 5 clinicians. And in about 2023, we had a total of 25 employees.
That's very impressive. I think it's very impressive growth in the matter of 5 years, I would say so. So, what is your philosophy behind Anchor
Yeah.
Light Therapy? I think we want to talk a little bit about this organization. What is the soul of organization, and what this organization inspires to achieve?
So we are a behavioral health agency. We really focus on supporting relationships. So we do couples counseling, family counseling. We also work with individuals, adults, teens, kids. So really, we wanted to create an organization that supported the entire family system. We had gotten to about 25 employees, like I said, in 23. We were a brand new business, so there was a lot to learn in that process, and we eventually scaled down a little bit. We realized that we were better, or a better size for us was really more around, I think we have 14 employees right now. So it took us a little time to find what our sweet spot was, to get the organization set up in a way that functioned really well. Yeah, so that's kind of where we are today.
Awesome. Apart from, I think you treat patients of all ages, but apart from that, I think you are also providing multiple type of therapies as well. So do you want to talk a little bit about what exactly you are offering as services for patient at your center?
Yeah, so we do, all of our clinicians are certified, or excuse me, trained in the Gottman method, which the Gottmans they were researchers at the University of Washington. We're in Seattle, so their work is very well known in Seattle. It's an evidence-based approach to couples counseling. So everyone who onboards with us as a new therapist is trained in that method, and that is how we work with couples. We also provide different types of trauma therapies, including EMDR. We are also trained in emotionally focused therapy, which is another type of relational therapy. So it's a type of therapy that helps developed by Sue Johnson, that helps work with families and couples as well. We're a little bit eclectic. Every therapist has their own kind of passion, and some have some different skill sets, which is also what is great about working within a group, that you can typically find somebody that can support most clients that come through the door.
Yep, sounds great. Thank you. And
Yeah.
again, this stood out for us when we were looking at Anchor Light, and of course, we talked to other mental health organizations as well. So most of them are focused in one or two areas, but I think one thing that stood out was that you folks are providing quite a wide spectrum of services, supporting humans of all ages, but also multiple type of therapy, which is really, I would say, a unique point. So along
Yeah.
with that, if we extend this a little bit, um, you mentioned that before COVID, this organization started, and then during COVID, of course, there was definitely a spike in the
Yeah.
mental health space. I think many
Yeah.
organizations uh, did amazing growth. So, what are you? I believe that you went to a virtual care method as well. Are you currently also using virtual, or do you have 100% in person counseling at the moment?
No, I would say depending on the type of service, it so we definitely do virtual counseling. That the pandemic really opened the door for that. It's very convenient for people, so that is certainly part of our offering. But we do have an office where we encourage people to come and do services in person if we're especially if we're doing relational counseling. So if you're doing family therapy or couples therapy, we can do it online certainly, but it's kind of nice to have everybody in the room. Also for children, it's kind of hard to have them online for therapy that it is better if they can interact with the clinician. But that being said, it's a very convenient and really to do individual therapy, whether it's Zoom or in person, is pretty comparable. So we do both. So I would say maybe we're like 60% in person and maybe 40% online.
Great. So,
Yeah.
just for the sake of curiosity, I want to ask that in this space, in-house counseling by in-house, I mean you going to the patient house or your customer's location and providing them therapy services there. Is this something that is common or it's not in? Uh,
No, we don't offer that. They can come to our office, but we do not go to their homes.
right. Understood.
But people do offer that. There are certain settings where people would go out and work with somebody in their house. I think usually that would be more related, like if they couldn't leave their home. But that isn't something that Anchor Light offers. So we have an office in Queen Anne in Seattle that people can come to, or we can meet with them online.
Got it. Got it. So I
Yeah.
want to ask, I think if we analyze last 10 years, there are probably two defining moments, at least two prominent defining moments. One was COVID, as we were
Yeah.
talking, COVID did a lot of transformation. And the other one is we are going through right now. It's technology, artificial intelligence technology is
Yeah.
really uh, penetrating into many areas. There are impacts that we, all of us, are starting to see those impacts. So in your field, in mental health and behavioral health, how do you see artificial intelligence or technology playing a role right now or in near future?
So one thing that has been a huge support with AI is documentation, that we are required as therapists to document all of our sessions, to create treatment plans, and this is very time consuming. AI has made that so much easier that we can document our sessions, and so I really have capacity to see, I would say, at least like 30% more clients because I don't have to spend so much time doing documentation. So I think that has been the biggest thing for us. I think also just being able to get information, if you're thinking about a specific case or clients that you're working with, you can do research much easier. You're not going back to, textbooks or even Google searches. You can just very easily access a lot of different information that helps you better conceptualize cases and support clients. So it doesn't replace clinical judgment, but it offers you resources that makes everything much faster.
Got it. So the tools you are using right now, for example, EMRs, you must be using any EMRs and these tools like that. Do they
Yeah.
have any such AI enabled support that helps you offload administrative and operational burden?
Yeah, so we use Therapy Notes. It has an integrated AI tool, and it's really very comprehensive. You can choose the type of therapy you're working with. It can recognize the therapy, and you put in, for example, if you're doing a note, you'll enter in the note, but then it'll go through it and make it to insurance standards, and it just put it all in clinical language. Same with treatment planning. So it's still the clinician is doing the work, is coming up with the ideas and thinking through how they're going to support the client, but the AI is writing it all up in a much faster way.
Got it. Got it. So as an organization, how does and if it's happening or not, Do you also have to go through audits and compliance processes as well? And if so, how extensive they are from, I mean, from government or state level agencies?
Yeah, so got an agency. So we started as a group practice and we got an agency license about a year and a half ago, where we are a licensed agency through the state of Washington. We had to get the preliminary license, we had to submit all of our processes and our manuals, our operating procedures, all of that. So that's how we got our initial license. And then we are going through our official audit, where they're going to come in and audit our records with it. I think it's in April that they're going to do it. So I haven't gone through the full audit yet to answer that question. But yes, the state comes in and they audit all your processes, documentation being one of the things that they'll look at.
Got it. Got it. So I'm sure AI is going to be great help, of course, in your next audit cycles, because it can, of course, many people we talk to, they one thing is everyone agreed is, especially in mental health and behavioral health space, that they want to use AI for administrative work, but yes, there is little bit of I would say division between whether AI should be used for clinician work as well or not. So there are two school of thought. One school of thought is depending more and more on AI, but the another school of thought, I would say, is a little bit careful
Yeah.
on relying more on AI. They want human in loop. They want clinician to be doing the supervision and oversight. So on the
Yeah.
same, you I think wear multiple hats at your current organization. If I
Yeah.
understand correctly, you're also a
Yeah.
clinician, but you're also a founder and CEO of the
Yeah.
company.
Yeah.
So I'm sure it's full of challenges. How do you balance between both? It's these two are, in my humble opinion, two different mindsets. How do you balance in both of them?
Yeah, so my husband runs the business with me, and he is actually not a clinician. He has a business background, and so he really does a lot of the operating procedure type aspect of the work. So that allows me to do what I love, which is to continue to work with clients and also mentor other clinicians. So I guess that is, of course, I'm involved in the business as well, but I definitely have that additional support. I think it'd be really hard to wear all of those hats without a good team around you.
Makes sense. So if I ask you about the typical challenges you face at Anchor Light, typical challenges that frustrates you, or that you feel are slowing you down. If you have to mention one challenge from clinician point of view and one challenge from a CEO point of view, what those challenges would be?
Well, from a CEO point of view, I think the biggest challenge has been finding the right staff, having the right systems in place, making sure everything is running smoothly, that everyone knows exactly what to do, that we all operate in the exact same way. As a group, we are selling services to our client as anchor light, so all of our clinicians do need to meet certain standards and be working in the same way. We can't have people just kind of going off and doing 100% their own thing. So from a CEO standpoint, that has been the most challenging part. And then I think for a clinician standpoint, I love client work. I think documentation has really been like the thorn in everybody's side for years, is all of the notes that we have to do. And so AI has just been tremendous in changing that. And that's within like the last year and a half, I think we've had the AI tool in our EHR. And it's been, I mean, that's changed a lot. So I think people don't find that to be so daunting anymore, that it is really manageable now that we have that support.
Absolutely. Thank you. Thank you for answering this. And if I may linger on the same one a little bit, do you also feel that with AI coming in, the burnout has reduced in your workforce or in your staff? Because I think clinicians, they love doing the clinical work, but previously they were feeling burnout a little bit more, because after a long day of clinician work, they had to go in and do the documentation and fill in the forms and do the paperwork. Do you think that this is the correct assumption, that AI is helping reduce the burnout of clinician?
Absolutely. So our therapists usually see, 4 to 6 clients a day, which means that they have 2 hours to work on other things like planning and documentation. Prior to having AI, if you saw 6 clients in a day, it probably would take you more than 2 hours to do all of the documentation. Now you could probably do it in a half an hour. So it definitely is reducing the amount of time that you have to spend. There are things that clinicians need to do, like to think about their cases and to research them, that might take some extra time that AI can also help with. But yeah, I feel like it has significantly reduced the administrative load, which is what most clinicians report is the part of the job they don't like.
Yep, absolutely. So I think you mentioned you scaled, then you scaled down as well. Of course, I think you are
Hmm.
also one of the person who is actively involved in recruitment as well. So how do you make sure,
Yeah.
because of course the space you operate in, it is very important that the staff you bring on board should really understand the patient centricity as well. They should really understand the importance of providing best possible care. So how do you make sure that the people you are hiring are going to be right fit for your organization?
We are a private pay, out of network practice. And a lot of our clients are working professionals. And so the service that we offer, we want to just make sure that we're offering a really high quality service. So we want somebody that is committed to learning the skills to bring that to the clients. Also somebody like that has the capacity to see 4 to 6 clients per day. You mentioned burnout. I think, some people experience burnout easier than others, and so we want to make sure somebody has the capacity to do this as a full-time role, and that isn't everybody. Um, what else? Somebody that has a teamwork environment. This is also a profession where a lot of people work in private practice. They work individually. I did that for many years. And for me, I really love the collaboration of a team. I don't want to kind of do a really independent thing. I want to be working with a team. A lot of our clients have multiple therapists at our agency. So like I could see somebody for couples therapy, another person might see them for individual therapy. We might see their child for child therapy. So we want people that can work really well as a team and collaborate together.
Got it. Thank you. So, um, what exactly your pipeline looks ahead in terms of recruitments? If you consider next 1 year or 2 year, do you believe that you have the right staff number in place, or you are looking ahead at recruiting more people? And if more people, you are looking to expand your team on the clinician side, or you are looking to expand your team on, for example, technology and engineering side?
So I think that we're the right size right now, and we'll look to backfill if anybody leaves the agency, but we're probably going to stay right around this side. I think some things have changed in the marketplace a little bit that we've responded to as well. So there was a huge boom during COVID. A lot of people were working from home, so they were able to do sessions any time of the day. Um, and the economy in Seattle, where we're located, the tech economy was booming. So that has all shifted a little bit right now. There's been tons of layoffs in tech, which changes the market a little bit for us, especially being private pay. Also, people don't have the flexibility that they once had. They had to go back into the office. And so it's harder for us to fill morning appointments. We do more evening. Most of our clinicians work from like 10 to 7 or 11 to 8. So we can accommodate afternoons when people aren't working. So from that perspective, I think, the size that we have right now is really where we want to stay. We want to continue thinking about how we can offer a really superior service and for clients, whether that's making additional resources available for them, supporting our clinicians and just offering a really superior service. And so with that, we are looking into using more technology, having resources that are both our clients and our clinicians can access.
Got it. So do you have, how does your patient engagement process right now works? I'm sure they are coming in for appointments, and you're also doing sort of virtual consultation as well. Do you feel the need for active patient engagement? For example, sending them any for example, exercises or anything to read or anything, any video to watch. Is there any such sort of communication that happens from your end oftenly? And if so, are you using any tools or any automated softwares for that?
So we do send like resources and homework and different things for clients to do, and that's actually a project that we're working on right now that has not been completed yet. So I can't talk too much about it, but that historically it has just been the independent clinician just sending things, emailing things to the client. We're looking to really centralize that and have it standardized. And so again, when a client comes to us, they're getting a pretty consistent service across the board and having access to all of the resources that we want them to have access to. So that is in the works. We haven't launched that quite yet.
Got it. Got it. Sounds great. So, one key thing that really matters in healthcare is integration. Your organization's integration with the community you are in, or the community you are serving. But apart from that, your integration with other softwares, tools, or platforms as well. So, if you have to talk from your perspective, your integration landscape, how well do you believe that you are integrated with community and social service in the area you are operating? And apart
Yeah.
from that, for example, your EMR can be integrated with many other tools or software in order to improve the quality of care for your patients. So where you are with respect to these two points on integration?
So I feel that we are well integrated into the community. We do a lot of networking with other organizations. We're an outpatient facility. We offer lower services for lower acuity clients. So we do have relationships with some inpatient and intensive outpatient people who clients might go see them, and then once they're done with those programs, they could come see us, or vice versa. If somebody needs a higher level of care than what we can offer, we refer to them. So we do know a lot of the other agencies within the community and have a lot of connections there. And then as far as our EHR, EMR integration, that has been a little bit more challenging because of HIPAA. So the system that we have right now doesn't really allow for a lot of integration because it needs to keep everything really private. It would be nice if we could integrate more systems, but that is something that has been a challenge.
Understood. So what is the big picture vision for you and for Anchor Light? If you have to talk about where you want to be in next 2 years, what is the big picture for you?
In the next 2 years, I think we want to just keep doing what we're doing. We've gotten to a really great place in the business that works for us, and we just want to keep connecting with clients and supporting families in our community. We aren't really looking to grow probably over the next 2 years. Like I said, we've kind of found the sweet spot for the size of our agency, but just continuing to serve our community and offer, excellent mental health.
Asked. Thank you so much for answering with great insights.
Yes, thank you for having me.
And I think we will look forward to getting your story out there as soon as possible. Hopefully, in few days, we will be editing this video and we'll putting it online. And of course, I will keep you posted throughout the progress of this. But it was really great talking to you, and I wish you and Anchor for future.
Thank you so much, and thank you for having me. Have a good day. Take care.
Bye bye.
Bye.